If you're around age 60 with roughly $1 million saved up and you're thinking about retirement, you may be curious how that could look for you. So that's what we're going to talk about today, and we'll kind of go over it in two ways. Number one is we'll talk about some of the most important topics to consider as you get ready to make this decision. Then we'll also look at some specific numbers with a fictitious client. So this is going to be in my financial planning software. We've got Jane here. She's got about $1 million saved. There's $100,000 in cash. There's $700,000 in pre-tax retirement accounts, and then $200,000 in a taxable brokerage account. You can see her expenses here. She's going to spend $3,800 after tax each month, plus an additional $500 a month on healthcare type expenses. She's going to get a bit of a break because of her income and those ACA tax subsidies, which we'll get into in a second. So let's just dive in and see how things are looking. Now, I'd start by mentioning that you're in relatively good shape with $1 million. Now, I know a lot of people will say $1 million doesn't go as far as it used to, or I wish it was 2 million or something like that. But really, you are quite fortunate to be in that situation, thanks to whatever made that possible, whether that was hard work or some smart decisions or whatever else brought about this situation. $1 million is a lot more than many people have saved for retirement. So if we look at the Survey of Consumer Finances, the latest data available, we can see that those age 55 to 64 have about 400,000 saved up for retirement. That is the mean or the average, so that gets pulled up by people who have quite a bit saved up for retirement. And if we look at the median, and that is when you line up all the observations in order from biggest to smallest, the one right in the middle, again, is the median, and that's quite a bit lower, 134,000 for those between ages 55 and 64. So having $1 million puts you in a relatively good position. Now, obviously, it depends on where you live and what health factors you might have. So in certain cities, $1 million might not go very far, but in many places it is a decent nest egg. So let's just start by talking about taking withdrawals from those savings. So at that level of about $1 million in assets, there are things you want to be aware of as you get into retirement. So since you do have some savings, you're going to be supplementing your Social Security income or your pension. But for a lot of people, it's Social Security, and it's likely that you will pay taxes on a portion of your Social Security income. That's a nice problem to have, but it's something that you really want to know about so that you can be prepared and budget. As the Social Security Administration points out, if you only have Social Security as a source of income, you might not pay any taxes on those benefits, but you may pay tax on up to 85% of your benefit if your income is above certain limits. So they've got the limits listed on the website, and you can always go and look that up, but it's something to be aware of. So your income is sort of this goofy calculation where they have a combined income. It's based on any non-taxable interest plus 1/2 of your Social Security benefits. And there are some other complications and wrinkles in there. So look that up if you're very curious about it. But the point being that you might see this number get added on to your income tax return. So if we go to our friend Jane here, she's got Social Security benefits here, line 6A, and you can ignore pretty much everything else on this return. It's really just to illustrate the point of where your Social Security might get added to your income. A portion will be taxable, so that gets added to your other sources of income, and you can reduce it with deductions, etc. But it could be taxable income. So if you've got $1 million saved up, if you've got any amount saved up, there's a good chance that some of your Social Security will be taxable. And speaking of taxes, it might be smart to start planning ahead in terms of what brackets you might be in or what your income might look like. So here is Jane here, and she's in a pretty low tax bracket for the first couple of years of her retirement. In this case, they're just assuming that she's going to spend down her taxable assets and then start getting into those pre-tax retirement accounts. Now, that might not be the best way to do it. So if you do some planning, you can consider maybe filling up some of those lower income tax brackets. In other words, taking distributions on purpose and paying taxes on purpose, even when you don't need to, because that might help you out later. And if you don't need the money right now to spend, you could consider doing some Roth conversions instead of taking the money out and spending it. What that allows you to do is, again, to kind of smooth this out and fill in some of those lower income tax brackets. And just another way of looking at it is she is not even filling up that 10% bracket in these early years here, and then she has a big hump, and then her RMDs begin and she gets into higher brackets. But if she does, I just made this a simple what if, just kind of pulled a number out of thin air and said she pulls $20,000 a year out of pre-tax accounts. Maybe she converts it, maybe she spends it, just depends on what exactly she needs. But in that case, she's going to go ahead and take advantage of that 10% bracket and even pay a little bit more in what is currently the 12%, might become the 15% tax bracket depending on some changes. And she can possibly save some money by doing that. Whether or not it works out, only time will tell, and it depends on the details of each person's situation, but it's something to think about as you approach retirement. As you can see here, right around age 72, even though she's going to fill some brackets, her income is going to jump quite a bit. And that's, of course, because after you reach age 72, you have to start taking those required minimum distributions, or those RMDs. That's where the IRS says, we don't allow you to keep your money sheltered from taxes indefinitely. You have to eventually start pulling that money out of certain accounts and generating some taxable income typically. So that's what happens there at age 72 when the income jumps up quite a bit. Next, we get to the question of how much can you withdraw? In other words, will your money last for your entire life? And that's an important question because we need those assets to support you for hopefully a very long time. So one way of thinking about that is withdrawal rates. You may have heard of the so-called 4% rule or a safe withdrawal rate. That's more of a research finding than an actual rule that people follow, but it can give you a ballpark idea. I've got a different video that goes over withdrawal rates and why they're probably not the best way to go about planning, but you do want to look at how much you're taking out. And really over time, the amount or the rate or the percentage of your assets that you're drawing on could vary. It's very likely that it will. And that could be perhaps because, maybe you're going to delay Social Security, for example. You might say, I'm retiring at 60, but I don't get Social Security until 62 at the earliest. Maybe you're going to have to withdraw assets at a relatively high rate during those 2 years. Maybe you even want to wait until your full retirement age or even age 70 to start taking Social Security. So in that case, you would be drawing down your assets a little bit faster, which can be nerve-wracking to be sure, but it may make sense for you for a couple reasons. One is that gives you some room to manage your income and manage your income taxes. So you would be able to take money out of those pre-tax accounts before your Social Security begins. And that way you have a relatively low income otherwise, so you can use up that low tax bracket by taking distributions out of your pre-tax accounts. You might also want to just have a maximum Social Security benefit that's available to you. You might say, look, I'm pretty healthy. I expect to live a long life. So in that case, it's going to make a lot of sense for me to maximize what I can get from Social Security. So I'm going to wait, and that might mean spending at a relatively high rate in those years that you delay. But once you start getting that bigger benefit, the rate at which you withdraw declines. So there's not a right or wrong answer that can be, just a blanket answer for everybody, but it's something you want to think about. What's best for you? So just as a quick example to paint the picture with those numbers, we've got her claiming as early as possible here. That's age 62. And if we bump that up to age 70, the odds of success increase. Now, that's just based on what's going on in this example. So it's not going to be the case for everybody, but we can glance at her withdrawal rate, and this has her waiting until age 70. So she's going to be at a relatively high rate during those years while she waits, but then that eventually drops off once her benefit begins, versus if she starts as early as possible taking those benefits, she will presumably be starting at a much lower rate. That's once she reaches age 62 here, 3.1%. And so in this case, she's not, taking that big dip in those early years or taking a big bite out of her assets in those early years. Sometimes people ask, do I really need to withdraw from my assets? Can I just keep the principal or the corpus intact and just draw off of the earnings? Maybe I'm getting dividends or interest or something like that. And what I would say is for most people, that's just not realistic. At $1 million of assets, even though you are relatively well off, it's probably just not enough to support you. If you think about what you might need per year, maybe it's 40,000 even or something like that. You say, I think I can get 4% per year. But the question becomes, will you be able to do that year in and year out for the rest of your life? And you might live another 30 plus years. There might be market downturns. There might be periods of low interest rates. So there are just some problems with trying to live off of the interest. So for most people, you are going to be withdrawing your assets and spending things down, hopefully over the course of your life with, something left over as a safety net. So we kind of already talked about the Social Security strategies in terms of waiting, because that gives you some room to use some tax strategies. Want to just touch a little bit on the claiming age and how all of that works if you didn't already know. Your full retirement age, or your FRA, is when you can get unreduced benefits based on whatever your Social Security statement says. And your FRA depends on when you're born. So for a lot of people approaching retirement these days, 1960 or later, their full retirement age is 67. That's when you get that number that your statement says is your FRA benefit. But you could still claim as early as age 62. If you do that, that's early claiming, and you get a reduced benefit. So in this case, if your FRA is 67, your reduced benefit would be about 70% of the FRA amount. So if you were going to get $1,000, or for each $1,000 a month you were going to get, you would end up getting $700 per month, and that lasts for the rest of your life. It doesn't change when you reach your FRA. It could possibly, change if a spouse claims or a spouse passes away or something like that, but let's leave that out of it for right now. You can also delay taking your benefits. So if you do so, for each month you wait, you get a little bit of a bump up. So that's always helpful if you're hoping to increase your benefit. That continues even after your full retirement age. So after that, you're getting basically 8% per year. But again, it's monthly, and the details on the timing can get a little bit convoluted. So do some research there, but just be aware that if you do wait, you could end up maximizing your benefit and getting a bit more. And that's why when we looked at Jane's case, her odds of success actually improved a little bit when we had her claiming later, as opposed to claiming as early as possible. The right age for you is just going to depend on a number of factors, so you want to look at all of those different moving parts. So are you married? Have you ever been married? What are your assets looking like? Do you have enough that you could spend, or will you come dangerously close to depleting those assets? Are you in good health? A number of different questions that you want to look at. So let's get to health care. That is an expense even in retirement. So especially at age 60, you've got that 5-year gap between when you're stopping and when you are eligible for Medicare. So what do you do about that? And it kind of depends on your situation. So if you have retiree health care, that could be an easy one for you. You might just continue on that. Sometimes you can get a better deal going out and shopping for your own policy and not using your employer's retiree health care. It just depends. Now, if you leave a job, you can potentially use COBRA or your state's continuation for roughly 18 months. It, of course, depends on a lot of things, but that's a way to continue your existing coverage if you want to temporarily, but that doesn't get you until age 65. Another option might be if you are married and you have a spouse who's covered by some form of coverage that allows you to get on their plan, you might be able to switch to that plan, and that can help you stay covered. Then another option is going to be to go and purchase coverage, often through a marketplace or an exchange that allows you to shop different plans available in your area And if you are retired and your income's relatively low, you might qualify for some relatively low premiums. So here's a little calculator from the Kauffman Foundation that gives you a rough estimate. Obviously, you want to verify this with the local providers in your area, but let's say a national average here, if you were making 45,000 or showing 45,000 of income for this, we're talking just one person age 61. The cost for a silver plan might be 271 bucks per month. So that's, pretty affordable when you look at what you would have to pay if there weren't these types of subsidies or these ACA type discounts. Now, if your income is a little bit higher, we were at 271, that bumps it up to about 390 per month. So you want to think about managing your income during those retirement years, especially maybe between 60 and 65, so that perhaps you can save money on premiums. Now, don't necessarily let this dictate everything you do, right? So if you say, well, I'm not going to take any taxable income so that I can keep it as low as possible, that could be smart. It could be maybe not the best choice. It just depends on everything else that's going on. So at least think about that and do a little bit of research to see what makes the most sense. Now, once you get onto Medicare, you're eligible to get on there. How much are you going to spend? Well, in today's dollars, just original Medicare, you might be looking at total out of pocket of, let's say, $5,700 per year. Who knows? This is a 65-year-old woman who, doesn't have a lot of serious health issues. This is just a ballpark guess, but you've got premiums and you've got out-of-pocket costs. You can also look at adding supplemental coverage or something else to help and cap your risk. In other words, you can put a cap or an upper limit on what you might be spending, especially if you're in the worst case scenario here. This person is going to spend less out of pocket, although they will spend more on premiums. And that's, kind of the trade-off of using insurance. So speak with a health insurance broker several months, at least I'd say, 6 months before you're age 65 to start exploring this. And you want to sign up early because you definitely don't want to sign up late. There can be a permanent penalty or an increased cost if you miss the enrollment deadline. So do that and get enrolled early and make sure you've got some good coverage. So if we go back to Jane, we had her spending about $5,800 per year once she is on Medicare, but before that, she's got pre-Medicare health costs of $500 a month. That's, might or might not be the right number, so that's in addition to the other spending she has. You just want to look at what is your health like, what area do you live in, what are the costs like for that. And so when we go to her expenses, this goal here is showing that healthcare costs, and I like to inflate that at a rate that is faster than general inflation. And then, of course, at age 65 is when her Medicare type expenses start kicking in, and again, that inflates faster. Now, there is always the question of long-term care. So what if you need help doing things? What if you develop dementia, Alzheimer's, that type of thing? The cost can really go through the roof. But there are a couple of ways to think about it. One is you might self-fund it. And in many cases, you can say, maybe I can fund a relatively small long-term care event. So that could be having somebody come in for a couple hours and help out with things. But if you do end up going into, let's say, memory care, you need 24-hour supervision, you need bed alarms, that kind of thing, the costs can really get high. There's just no telling what it would be. But, assisted living facility might be about $4,500 a month. Private room in a nursing home, you're getting up there at $10,000 a month. And that's where you want to start thinking about things like, do I have equity in my home? Would I sell the home? Who else needs to be in that home? Who's depending on things? What are the different resources that might be available? You can also consider insurance products, and those are pretty complicated and they've been problematic historically, but it could be worth at least looking into, and you can decide, do I want to rule that out or do I want to think about it? What's going to be best for me? It's really one of the most difficult problems in retirement planning right now. This long-term care question is really one of the most vexing problems that you have to deal with. and I don't have a simple answer for you. By the way, time for a friendly reminder that this is just a short video. It can't possibly cover everything, so you really do need more information. So please talk with some professionals, do a lot more research, hit pause and read this if you need some more time because it really is important. And I'm Justin Pritchard. I help people plan for retirement, and in the description below, I've got some links to some retirement planning resources that I really think you'll find helpful. Some of them are on these topics, things we've just looked at. Some of them are more broad about retirement planning. But if you are thinking of retiring anytime soon, I think you're going to find that information super helpful, so please check it out. Then there comes the question of what to do with savings that you've built up in retirement accounts, and do you move that over to an IRA that you control? Do you leave it with an employer? There are pros and cons of that, so you want to do some very careful research. So a couple of the reasons why you might move it to an IRA: you have more control, it can be easier to take withdrawals, you can customize the beneficiaries and deal with things like that. But there are some potential drawbacks. So you're already past age 59 and a half, that's good. But there are questions about, are you going to do some of those Roth conversions with any after-tax dollars? Is that going to mess things up for you? Do you have a good stable value offering in your workplace 401k? That's a conservative investment that typically pays more than banks pay or more than you can probably get in your IRA. And those are really only found in workplace plans for the most part. So maybe it's worth keeping at least a portion, if not more than that, in the workplace plan so that you have access to that stable value offering. There are also differences in fees and expenses. So if you have a great workplace plan, a great 403b, 401k with really low fees, good investments, it just might not make sense to move that money out of there. You really just want to look at all of the different aspects one by one and decide what makes the most sense. Touching on the softer side of things for a minute here, you do want to think about your mental and physical health. This is a very real issue. So again, you're retiring at 60, you might live till 90. What are you going to do with yourself? And you might love gardening or hiking or golf or whatever it is, but you just can't do that every single day. Even that might get old. I know you don't believe me, but even those things could get old after a while. So we want you to stay engaged, not only physically, but also with the things you do. So what can you do to keep yourself mentally active? There is some research that says if you retire a little bit later, you might live longer. And you can, quibble about what exactly is behind those numbers. What's the correlation and causation of who's working longer and then living longer? So there's some questions you can ask about that. But the point being, it's really important to plan for how you're going to spend your time. There are a lot of good resources out there that touch on this. Here's just one example. This is from MIT's Age Lab, and it's put out by Hartford. They partnered on this, but they call it 8,000 days. And so you might have 8,000 days in retirement, but those are kind of broken up into different phases depending on how things evolve over time. So you've got the honeymoon phase when you just stop working. You're going to go and spend a lot of money on vacation and fun things and time with friends. But eventually things start to change, and at the very end of life, you may have more of a healthcare setting type of thing. So you want to think about every day along that whole timeline and say, what am I going to do with myself? Who will I spend time with? Who am I going to go out to lunch with? Who's going to change the light bulbs in my house? How am I going to get to my appointments? What are the things that I most want to do with my time? And who do I want to be with as I go through all of these 8,000 days? And by the way, if you retire at 60 instead of 65 or at some point later, you've got a couple of extra days on that timeline to work with. So think about that, and don't just think about retiring from work. Look at what you're retiring to. I'm sure you've heard that before. It really is something that's important and helpful to think about. So I hope this has helped to paint a picture of how things might work for you in your retirement years. If you found it helpful, please leave a quick thumbs up. Thank you and take care.